We will resume the proceedings with the Honorable Chief Secretary speaking. You have 8 minutes.
Thank you. Madam Presiding Officer, at the break, I was on my feet and was about to treat with the issue of a teacher innovation center, because the reality is that some of our schools, both primary and secondary, are performing below par. And therefore, particularly in respect of our primary schools, the focus really is on the teacher, because consistent with pedagogical postulations, it is the teacher who has the responsibility to motivate and ensure that the students learn. And in this regard, one of our initiatives going forward is the creation of a teacher innovation center. And some of the key outcomes that we anticipate include, but are not limited to, one, the provision of effective teaching toolkits to be used by teachers; two, the issue of innovative lesson planning; three, professional discussions and collaboration and the need to share best practices; four, diagnostic, so that there is an identification of teaching and learning gaps and the development of solutions. And indeed, over time, the center will be so equipped so that teachers will be able to either visit or access the center through technology. So consistent with that, one expects that there will be more inter-school and intra-school teacher collaboration, a sharing of stories and learnings, a reduction in teacher stress, and a training hub to elevate the teachers and education in Tobago. Madam Presiding Officer, I move quickly to treat and make a statement in respect of two critical matters. One has to do with the Tobago Autonomy Bill, and the other has to do with the land title issue, which affects Tobagonians. In respect of the former, the bill is currently before the Legislative Review Committee of the Cabinet, and given what is required in respect of the changes, it is likely to require a 3/4 majority. And that has implications for us in Tobago, as I would have indicated some time ago, given the configuration of the Parliament at this time and the posture of those who now sit there. We in Tobago must be prepared to take the battle forward, because I suspect it will not be easy. And the Attorney General has agreed that within the next 2 to 3 weeks, he, the Attorney General, along with the Minister of Planning, will come to Tobago and will engage in discussions with the representatives of the THA on areas of the bill that are possibly in contention and would require some clarification. In respect of the latter, that is the land title matter, 6 bills have been drafted. 4 have already been laid in the Parliament. The other 2 will deal with the whole issue of fraud. And the intent, Madam Presiding Officer, is to have these bills debated in the September session of the Parliament. What I need to say is that in respect of the approach, the bills speak to the whole issue of compulsory land registration. And in essence, it represents a tidying up process, because many of our lands in Tobago, as you know, there is no real title for them. And therefore, there is a collaborative effort among, or joint enterprise among the THA, the Office of the Attorney General, and the Ministry of Planning to treat with these issues. The project, I am happy to say, would begin in Tobago at no cost to the residents. At this time, you may know, Madam Presiding Officer, that lands that have to be brought under the Real Property Ordinance, individual landowners must do so at exorbitant costs, ranging anything between $30,000 to $50,000. And you know, Madam Presiding Officer, the minority leader in his presentation did make reference to China as a model. But what he did not say is that the political situation or culture in China is such that I don't know that he would have been able to speak in China. But more than that, Madam Presiding Officer, what needs to be said so that those who are listening and feel that it is wisdom that was emanating, I read from a document, a report from Zaopin.com, and it says that wages for new graduates in China have fallen by 16% in 2017 compared to last year. The data is the latest in a line of recent warnings about the job prospects of new graduates and raises concern over future of China's job market. I go further to say that hundreds of millions of Chinese workers are still struggling to make a living wage. The cost of living in China's cities increases all the time, and the gap between the rich and the poor shows no signs of closing. In our case, Madam Presiding Officer, we took a conscious decision that we will not retrench anyone. In fact, that we will maintain employment levels. And if I had more time, Madam Presiding Officer, I would have gone into the value, notwithstanding the economic detractors who insist that we must send people home, of the contribution of the THA in respect of the disposable spend in Tobago, resulting in the circulation of money so that we can all, at this time, be enjoying a reasonable standard of living. And as I close, Madam Presiding Officer, I say to you and to Tobago that leaders must be prepared to eschew political expediency and lead and govern with courage, especially in contexts like ours, in terms of declining revenues and ever-increasing unrest. For our administration, what is right will remain right.
Member, unfortunately, your time is up.
Thank you, Madam Presiding Officer.
Can I ask if there are any requests to speak in the House? Madam Presiding Officer, members of the Tobago House of Assembly, members of the viewing gallery, those who are listening, those who are viewing us on television and online, good afternoon. This is certainly a special but bittersweet moment for Tobago. One where we are here again speaking about a budget for the Tobago House of Assembly that was presented last week that has honestly made me, and I would use the word sick, while sitting here listening, in addition to listening to other members joke about the lives of Tobagonians. It's actually rather sickening, and this is something that other Tobagonians have also expressed. Their disappointment with the lack of vision, the lack of planning, the lack of foresight, the lack of caring that seems to be a part of this budget that was just presented. Let me start, Madam Presiding Officer, by identifying a couple flaws in the process that was used by this Executive Council to create the budget that was presented. There are several models of doing development. One that is very simple, includes 4 broad steps. It's known as the PDCA cycle: planner, do, check, act. PDCA, planner, do, check, act. And Madam Presiding Officer, it seems as if we have not really done much planning, doing, checking, or acting for the last 16 leading on 17 years, and the members of the Executive Council spent the time laughing and joking, when in fact we were talking about the things that have been going wrong with the economy of Tobago. Madam Presiding Officer, one of the opening remarks that was made by the Secretary for Finance and the Economy was that a budget survey, some consultations, and other needs assessment exercises were conducted. However, Madam Presiding Officer, it seems from talking to people, listening to them on the radio and the TV and so forth, and meeting them in the public, many of the key industrial leaders in tourism, in marketing, in agriculture, everywhere, they seem to think that even though they may have been part of something you people call consultation, none of their, or very little, if any, of their recommendations were actually placed in these documents. Madam Presiding Officer, that is very disheartening. In addition to not listening to the stakeholders on the ground, we seem to also not be listening to the stakeholders who are who have the technical capacity to guide us. As a matter of fact, I have looked at several reports that were done by strategic units of the Tobago House of Assembly, and it's quite obvious that even going through the statement, going through the budget, going through all of the documents, that those recommendations were also not taken into account. Madam Presiding Officer, whenever we talk about planning, we cannot think about planning as something we do just for today or for tomorrow. As a matter of fact, while we are planning for this budget, we should be looking at 5, 10, 15 years down the road to ensure that what we do today, 2017, or what is done in 2018, leads towards where we need to be in 2030. And Madam Presiding Officer, it is funny that when the Secretary for Finance sent out this call circular to have the different divisions create their budgets, what he referred to was the Comprehensive Economic Development Plan that ends in 2017. How are we planning for 2018 on a document that ended in 2017? It shows, Madam Presiding Officer, that we have not really seriously thought about that cycle. Plan, do, check, or act. Madam Presiding Officer, a part of the planning step includes what are known as having SMART objectives. And I am certainly hoping that when all of the other members speak today, that they could tell us what these SMART objectives are for all of the money, the nearly $5 billion worth of stuff that you are now asking for. SMART refers to specific, measurable, achievable, relevant, and time-bound. And I may suggest that you actually listen. Specific. Specifically, what are we going to do? What are we going to do? What are the goals? Why are these goals important? Who are these things supposed to benefit? I'm hoping that we would have answers for many of those issues. For example, maybe this is written somewhere else and you can tell me. We seem to be asking for $2 million for feasibility studies to do everything. There's a feasibility study that is supposed to be done for something at the Englishman's Bay facility. Now, the fact is that we've been here for the last 16 years. So I am not sure that having a feasibility study for what needs to be done is where we should be spending $2 million right now in this go-over season. Those objectives, Madam Presiding Officer, needs to be measurable. How are we going to know when these goals have been met? For example, we are asking for $77 million for URP. It's one of the largest requests that we are having. But what are we going to do with that money? What is Tobago going to do with that money? At the end of the $77 million, how many walls, how many drains, how many whatever you plan to do is going to be erected so that we know at the end of the year, yes, we said we were going to do 50 of whatever it was, and we've gotten 50 of that done. Achievable. How realistic is the goal? We are asking again for $500,000 to do a feasibility study for Tobago marinas. Right below that in the same book, they're asking for $2 million to do a feasibility study on cruise ship boats. One is marinas, one is cruise ship boats. One costs $500,000, one costs 4 times that. Is it really achievable to have any of those things done? And by the way, we seem to have just learned a new word or a new concept, feasibility study. Because I have counted, and this was just a cursory review, just looking through very quickly, at least 10 different instances where the term feasibility study is being used to describe what we are going to do. Each of them costs, except for the one that's $500,000, each of them costs $2 million. On average, we are spending $20 million next year. Next year on feasibility studies. We need to know, Madam Presiding Officer, whether, what are you doing? You remember, the thing is, though, why this is so annoying is that you've said that you are just continuing what was done for the last 16 years. You've been there for the last 16 years. We shouldn't now be doing a feasibility study on all of those things. Remember, you're going further. That is what you promised Tobago. You are going further, which means that you didn't know what happened for the last 16 years, and we're now trying to figure out how to do it. We're now studying how to do it. Then we have relevant, going back to the SMART. Is it the right time? Does it match the current needs of the people who you are here to serve? Given Tobago's economic standing, Madam Presiding Officer, which the minority leader also corrected some of the information that was presented, you have to let us know that after you have spent, as you say, $5 billion, are those activities the best activities for dealing with the Tobago economy that we are experiencing right now? And by the way, what about crime? What about crime? Certainly, I hope someone will tell us what exactly is the plan for crime, because I can't remember, and if I'm incorrect, please correct me. I can't remember seeing anything about that, hearing anything about what we plan to do about that, and it is one of the issues that are very important to Tobagonians right now. Remember, it's not chicken feed we're talking about, eh? It's $5 billion. These objectives or these goals need to also be time-bound. When do we actually expect to get these results that you are talking about. Madam Presiding Officer, I know, personally, I know of DP programs that have been on the DP book since I've been back in Tobago, and that's at least 10 years now. And if you understand how the process works, a DP program is supposed to be a very time-bound one, a DP project, where you spend the money initially, you ensure that the project starts off, and then after you've done it for a couple of years, you do an evaluation. And after that evaluation is done, you are able to say, okay, it is something that makes sense, it is something that we will continue with, it is something that we will have staff for and so forth, and you carry that over to the recurrent budget because it is something that you've already gone through the process and you know it makes sense. Has this been happening? Not for any of the projects that I am personally aware of. So, Madam Presiding Officer, I am asking, what exactly do they expect to get from this $5 billion? The next step in the cycle is the doing step. Remember PDCA, the doing step. And Madam Presiding Officer, this is where you actually implement the actual activities that we are talking about. We have a track record of spending, what is it, over $40 billion in this Tobago House of Assembly. And when people ask, after 16 years, what have you done? What have you gotten? Where have you what? We are still looking. We still give the same answers. The cultural complex, the library, it's the same answers. And I have the feeling that because of all of the feasibility studies that we'll be doing this year, at the end of the 17th year, with this PNM administration, the answer would still be the same. Because you are accustomed to no doing. Somehow the money gets spent, but you are accustomed to no doing. The third step, Madam Presiding Officer, is the one that relates to, and I think, the most important part of this process. And it has to do with how we actually evaluate what we do. How we actually evaluate what we do. And I'm going to outline 4 different kinds of evaluations. And I'm taking time to talk about the process because we've been spending the money, we've been doing it, and we have not been following through with the correct process, which would explain why after $40 billion, we still don't know what we have for all of that money spent. So the first of those is what is known as process evaluation. And that, Madam Presiding Officer, is very simple. Are we doing what we said we were going to do? You said you were going to have 10 workshops. Did you actually have 10 workshops? It's as simple as that. The second one has to do with impact evaluation, and this is where we seem to have a problem, not just in Tobago, in Trinidad and Tobago. When you look at the reports for the PSIP and the SSIPs, they tell you that one of the problems is that we do not know what we are getting after we spend all of this money. I know that for a fact, Madam Presiding Officer, I was actually in the Division of Health and Social Services, and I was the one responsible for pulling together a lot of the reports to send down for SSIP and PSIP, so I know what I am talking about. Impact evaluation. That is where you immediately see if the money you spent did anything. So, we're going back to business. We're talking about developing businesses and so forth. You have just given somebody money, or you've done a trading so that business people can improve their accounts. There needs to be a way, a very set way, a very specific way of determining if at the end of the workshop, at the end of spending the $1 billion, at the end of spending the $4 million, that those people have actually learned what you said you were going to teach them. That needs to be outlined now because it's important for how the rest of the year rolls out. And then there's the outcome. Those businesses, in 5, 10 years, are they still thriving? When we read about the GDP of Tobago in 5, 10 years from now, how many of those businesses would be part of that process? And it's important, even though we're talking about 5, 10 years from now, you have to build into the system now how we are going to collect that kind of data. And the fourth kind of evaluation, Madam Presiding Officer, is one that is very near and dear to my heart. It's really looking at accounting for the money that is spent. We've done it for the last 16 years. You hear the Auditor General's report every year. We cannot actually do a report on Tobago because we don't know, we're not getting the information. We're not getting the information. So there needs to be specifically audited accounts for particularly those companies. You see those things that we call the special purpose companies? I don't know, we seem to be using those as a way to get around having to follow the procurement process. I don't know. But we have all of these quote-unquote special purpose companies that we keep giving money to every single year. However, when I looked at the revenue book, I specifically went looking for different special purpose companies to see how much money they are actually making, how much money they are actually giving back to us. You know, that is important because, for example, the Esplanade, the Milford Road Esplanade Company, whatever that is called, we are giving them, or we are proposing to give them $15 million. How much money did they make last year, did the year before? We are going to give, as proposed, the Fish Processing Company of Tobago, that's the one with the boat that nobody seems to be able to find, $6.6 million. We are going to give, according to the books, the Tobago Cassava Products Limited, $1 million. The one that seems to not be able to produce any kind of cassava products, but we're giving them $1 million. We are giving the Tobago Cold Storage and Warehouse Facility $3.8 million. The Cove Eco-Industrial and Business Park, $85.4 million. Now these companies, they say, are the ones that should be making money for us, but we don't know. We simply do not know because there are no audited accounts. And if they are, please stand on a point of order and let me know, and please hand over a copy of these, the audited accounts for these companies. We also have the Venture Capital Fund Limited, the Tobago Information Technology Limited, the Pigeon Point Heritage Park that we know keeps hosting all of these big events and so forth. Please, for the sake of all of us, let us know. And by the way, as we're talking about money, and again, I could be very wrong. I can't remember seeing anywhere where we wrote about how much money is actually in the consolidated account. Maybe I didn't. So that's what I said. If you could point to the page, Mr. Jack, please let me know. I would appreciate that. How much money is actually in the budget. But I also would like to know, because I remember hearing some time ago, at the end of every budget period, you will always hear about how much money has been left unspent. I have not heard anything about that, so I am assuming that all of the money has actually been spent. Maybe it is there. If I am wrong, please point me to the page. I do not mind standing corrected. Madam Presiding Officer, again, we're talking about these special purpose companies, and I know you're probably going to tell me this one is not under your purview, but I remember there was an announcement about the cabinet creating what is known as a Golden Grove Buckle Limited Company, Limited, to treat with this game changer that is called Sanders. This thing that is supposed to be like manna from heaven to save everything that we have going wrong in Tobago. We would like to have a little bit of information about that. We've gotten to the point now that we've been beaten into submission, so it's happening, so apparently it happened. But it would be nice if somebody would actually state, where is this hotel going to be? We seem to not even be able to answer that particular question. So I'm hoping, at least at the end of today, we would know where the hotel is going to be, and you would let us know if there are any agreements we should know about or anything like that. That would be nice, since this is going to be manna from heaven and is going to save us. Madam Presiding Officer, the last step of the PDCA cycle is the one that refers to acting. This is the one where you are supposed to, because you've been doing all of that evaluation over time, this is the one that is supposed to let us know, A, You see that project you're doing? Stop. It's not really giving you the benefits you wanted to give. So let me hold a little bit on that, tweak it a little bit, or start over. Let me do something else. That is the acting part. Assessing, reassessing, and determining whether what we've been doing makes sense. And it is very, very obvious that from the last 16 years of failed projects that we keep funding over and over and over again, that we have not been doing any of that last part, which is saying, hey, stop. Let me figure out if this is really working and then go from there. So, Madam Presiding Officer, while listening to the budget last week, when I said I got sick, it's because, you know what? I think what happened is that I started hearing all of the big words. I started hearing all of the big words that we keep saying. And we're hoping that nobody noticed that when you string a whole set of big words together, it still doesn't make sense. It still does not make sense. And because maybe I know that I have a little dictionary that could find some of those big words, I've actually tried going back and looking at them to see what they actually mean. And at the end of it, it still made no sense. It didn't. And by the way, Tobagonians are not fooled. Tobagonians have not been fooled. They have not. They have been coming and they've been telling us and they've been commenting and they've been saying, this is utter, it is not working. It is simply not working. And they have not been fooled. So, Madam Presiding Officer, if we are saying, and going back to some of the key pillars or key large, broad categories that were highlighted before, if we talk about building economic resilience, then, Madam Presiding Officer, we should have been focusing on ensuring that the private sector is a thriving private sector. Because any economy that does not have a strong private sector is not a resilient economy. What we should have been doing is figuring out a way to transition some of those workers that we have, the 60, 65, 70, whatever is the number, percentage of workers, of Tobagonians. No, I said transition, and you need to allow me to finish the sentence. Transition them, some of them, into the private sector. How? Because remember, the private sector is saying that they need workers. They need workers, and we have all of them working early morning work for a whole day pay, and when they try to get them, they don't get them to work. So we need to figure out a scheme to transition them from, by us, in the government sector, to the private sector who absolutely needs them. That includes training. That includes having apprenticeship kinds of things. That includes having some kind of partner payment method where we may pay part of the salary and the private sector pay part of it. See, we could talk about these things because these were things that were raised by members in the Chamber of Commerce. See, if you listen, Madam Presiding Officer, what has been happening instead, however, is that what we've been doing, and I've heard it from several different people, and I've seen it myself, we have a lot of the gangs, and we're sending 2, 3 of them in the same spot. Or 1, 2, 1 here, 1 down there, 1 up there, and hoping that nobody notices that you have 3 gangs working on the same street doing absolutely nothing.
That's what they can do.
Or the other thing that we've been hearing about is that you've been sending people whose contracts have come to an end, you tell them go home and wait for a call. The administrator would call you or whoever would call you, and they've been waiting and waiting and waiting and waiting and waiting. Instead of being honest with the Tobago public and let them know exactly what you're doing. Up to today, while sitting here, I got a message from somebody who said we really, really need to talk about it because they are one of them whose contract will be coming to an end just now and they really don't know what would happen, and the numbers of those are so many. What you're doing in that instance is creating a fear of the workers that again results in the level of unproductivity that we are currently seeing. Knowing that the bulk of the private sector currently needs the air and sea bridge to survive, Madam Presiding Officer, is one of the reasons, probably should be the main reason, why the answers to the questions about the boat, whether it's the cargo, whether it's the passenger, or the answers to the questions about the flight, those questions should have been top priority for this Tobago House of Assembly, full stop. Because the bulk of our needs come from Trinidad. And whether you want to agree with it or not, the fact that that has not been working the way it should is the reason why the economy has been dwindling the way that it has. I actually have to ask my friends, what is the busy season in Tobago? Because at one point, it used to be every weekend that it have a fete, every weekend that it have a line. But now, we have a situation where Trinidadians are saying they're not coming even if it have a fete or a line because they don't know how they would get back home. So I am still trying to figure out, when you say the boats are going to come for the busy season, what does that mean? Exactly when is that season going to come? And I understand that the Minister for Tourism, I think, said that they are going to do something to ensure that Tobago has a greater say in how at least the Port Authority is run. But we all know that that is the same Minister of Transport that has been promising a boat. It's like a 2 weeks. Every time he speaks, it's 2 weeks. Every time he speaks, it's 2 weeks. So I'm not sure how many of us actually believe when he says that he is going to do something, whatever it is, to ensure that we have a greater say in that process. That is what we should have been talking about, how to ensure that the things that affect us here in Tobago are the things that are top priority for the Tobago House of Assembly. Instead, Madam Presiding Officer, we have been getting apologies and imminent and those, whatever those words mean. Madam Presiding Officer, if we were really interested in revitalizing the agricultural sector, then we would know that we should not be taking our most fertile lands, which we keep doing, and building houses on them. We talk about Corland.
Remember, you have 3 minutes left.
We talk about Corland and the fact that we'll be building houses in Corland. And I understand that's actually some of our nicest, primest agricultural land. But in addition to that, Madam Presiding Officer, we would not be spending the largest bulk of our money, what was it? $80 million on what is known as agricultural access roads, $80 million on agricultural access roads. When all of Tobago knows, and I've been told several stories, that when you say agricultural access roads is really another word for bubble kickback and corruption and thieving. That is what it is. I will not call names, but you all know I know names that can be called. So no. If that is the most important thing, there, considering what the minority leader spoke about in terms of the technology and so forth that's needed, then hey, we're not really serious. Madam Presiding Officer, if we had actually listened to the farmers, we would know that it is absolutely critical. One of their biggest issues is marketing. So we would be spending time and money and effort on revitalizing the marketing department to ensure that things that are made in Tobago are seen worldwide, all over the place, because there are people who are willing to spend top dollar on items that have been made in Tobago. And we would be spending money on doing research and development. Research and development. And as the minority leader said, that includes ensuring that we have top-class institutions here on this island of Tobago. Top-class institutions, one of them could be having the Kendall Farm School, being the place of agricultural research and development for the Caribbean. Madam Presiding Officer, as we talk about tourism and human capital development, again, it seems like sandals is the only thing. Sandals is, again, manna from heaven that will save everything, save us all. Haven't we learned from what happened with Hilton? Haven't we learned from that? And instead of telling us about how many eggs Sandals will need, instead of doing that, we should be rolling out a very comprehensive plan to ensure that the people of Tobago, the farmers, the everybody, the fishermen, the everybody, are really, really, really prepared for what Sandals will bring. By the way, that document was already done in collaboration with the Travel Foundation in 2004. There was a comprehensive document that talks about what we need to do in Tobago to be prepared for these all-inclusives. And it was completely ignored.
Councillor Dr. Israel, your speaking time is up.
Madam President Officer, I beg to move that the speaking time for the Honorable Councillor Israel be extended by further 10 minutes.
That speaking time will now be extended by 10 minutes.
Thank you. That document was completely ignored. I have a copy of it if anyone needs a copy, because it spoke about what the agricultural people needed to do to be prepared for Sandals. It spoke about what the fishing people needed to do. It spoke about all of those things, what the tour guides, what those people needed to do to be prepared for something like Sandals. Instead, and remember 2014 was within all your time. 2004 was within your time. And we had 13 years to prepare for this thing that is going to be manna from heaven, that you have simply ignored for the last 13 years, and now you're going to try to, well, I don't even know what you're trying to do. We're still waiting for information. So please, let us know. Madam Presiding Officer, if we spoke about really doing youth development, then what we would do is move very swiftly to ensure that the tertiary institutions in Tobago are local tertiary institutions. And why is this important? Having actually taught at several of them, I know for a fact that the curriculum that is done at all of these schools do not really have Tobago and Tobago's development in mind. See, at a university, at a tertiary institution, what is supposed to happen is the students are supposed to take the problems of the area that they live in and study it, come up with solutions within those kinds of institutions, and then come out back with papers and those things. The tertiary institutions that we have in Tobago, those curricula, they are not geared to what we need to do here. Therefore, if we were really interested in that kind of youth development and that kind of human capital development, we would be spending a lot more money, and I'm glad you said you would work on THTI, because that is a very, very good start considering where we're heading with this tourism thing. But even that shows that we have not even really thought about what kind of teaching, what kind of development is really, really needed to make Tobagonians prepared for this wonderful Sandals that is going to come. Because what you all seem to not be saying is that because we have wasted the last 13 years since that Travel Foundation report came out, since we've wasted that time, and since the same Sandals is going to be coming anytime now, the average man on the ground will not be prepared for that. And what they will do, like they've done in many other countries, is yes, they have agreements that says we are going to buy from locals, we are going to hire locals, and so forth. But they set the bar so high that even if you start that way a year later, 2 years later, the locals cannot compete. The locals have not met the standard to stay there and to keep working. And then what they say is, okay, we tried to get the how many 100 eggs. We tried to get whatever, we can't get them here, so we'll go somewhere else. And you can't stop them, you can't do anything about it because we wasted under you are one, the last 13 years getting prepared for this. Madam Presiding Officer, and I'm wrapping up, I'm not even going to take the whole 10 minutes. It is very obvious, it is very sad that after being there for such a long time, after sitting back and promising Tobago that if we vote for you, we'll take you further. It is sad that we are simply going further into the dismal economic status that we have been in. That is extremely, extremely sad. Because we had an opportunity in this budget, Madam Presiding Officer, to really say, hey, Tobago, we love all you. And this is what we will do, so that by 2030, we are going to be in a completely different position. Madam Presiding Officer, it is sickening, it is sad, it is disappointing, and all of those words, because it is very obvious that you guys either don't know what you're doing, or you know what you're doing, but you simply do not care about Tobago. I thank you.
Councillor Dr. Carrington.
Thank you, Madam Presiding Officer. Members of this House, members of the viewing gallery, the Tobago population, the Trinidad and Tobago population, our regional partners, good afternoon. I am pleased to participate in this discussion because it allows me to treat with those matters that have been accomplished within the last 16 years in health, and to look towards those areas that will be addressed during this fiscal period. So rather than dealing with sickness, I am going to be dealing with wellness. And so we intend to make Tobago the preferred destination for healthcare delivery, and much of which I will speak to will be some of the gains made, notwithstanding the discourse about gains not being made. Madam Presiding Officer, in researching, and a lot of discussion around researching, and I'm hearing about planning, and we had a bit of lessons on that, and a lot of teachers are plenty. Not many of those could boast of being professors. So that let's not deal with teaching today, let's deal with the facts of the matter. With respect to work done by the Pan American Health Organization, Madam Presiding Officer, Trinidad and Tobago is experiencing an epidemiological transition where we see a decline in communicable diseases, but a rise in non-communicable diseases. And therefore, I will speak to wellness and not sickness. Earlier, the Honorable Chief Secretary pointed to some of the things we can boast about, but I'll point to that in a little while. Good service delivery, Madam Presiding Officer, is a vital element of any health system. And so as we seek to treat with service provision, financing, stewardship, and resource allocation, let me just engage you for just a little bit. We need to consider the social determinants, the political determinants, and those determinants are important, even the economic ones, for a population of over 60,000. The network of healthcare delivery systems and the facilities through which we provide care are second to none. And you can look at what is happening in secondary care at Scarborough General Hospital. So we have one general hospital, 17 primary care centers, and 3 outreach centers. We provide, within the last 16 years and before, a comprehensive range of health services. Services are accessible to all persons in our population. We have good coverage, and so whether you're sick or you're healthy, you can present for care. Our services are client-centered, and so notwithstanding some challenges from time to time, we can still boast of good services being provided at some time. So both primary and secondary level, there has been improvement over the past 16 years. We continue to collaborate such that we can improve. With respect to accountability and efficiency, about which there was a bit of discourse, let me just say for any sector, that is a concern. And so matters with respect to accountability and stewardship will continue to engage us as we seek to improve those areas. So to efficiency. What is important, though, we give the assurance that we will continue in the interest of the Tobago population to improve any area in which it is deficient. Let's just look at the facilities just closer. The number of hospital beds in our country is an important factor in determining the health resources available to our population. I look at Japan and South Korea. They have the highest numbers of hospital beds per 1,000, an average of 9.56. OECD countries like Chile and Mexico, 2 and 1.68 respectively. USA, UK, and Canada, 3.26, 2.95, and 2.71 per 1,000 respectively. In the Caribbean average, 2.89, notwithstanding Barbados has 7.56. And so in Tobago, we have 5 per 1,000. Permit me to repeat, 5 per 1,000. We are above the Caribbean average. And that is something that is positive for us. Just looking in terms of the threshold requirements for the health sector, and for all the people who pose as planners and who have not been trained to the level they should be trained, please note the type of facility by population, by service radius. General hospitals. For a population of 150,000, 4 beds per 10,000 for a service radius of 80 kilometers. For a health center, for a population of 20,000, 4.10 beds per 10,000 for 24 kilometers radius. And so we could speak about successes within the past 16 years. And so permit me, Madam Presiding Officer, to speak to the health agenda in the context of the national agenda. We have reviewed the existing situation. We've done that. We've looked at our programs and services. We've conducted situation analyses. And we are leveraging a few areas. We are not attempting to do all of it at one time. So we will be focusing on research. We'll be focusing on decentralizing some services, one of which would be a family development. We are going to be enhancing our health services delivery. We are going to strengthen our leadership and governance, and we focus on improving public health response. Those are areas that we will be treating with. We did say earlier that we are attempting to leverage some areas this year. Now, with respect to research, and I heard, and oftentimes I come to this house, we listen to old talk. We want to listen to data. It allows us to make more sense of what is happening. I heard about evidence-based decision-making. This division will focus on evidence-based decision-making because, Madam Presiding Officer, data is important as we make decisions. And so the data that we have gleaned from the process we have engaged in will support the plans and which plan the budget provides the support for. In that respect, Madam Presiding Officer, we've expanded our policy research and planning unit because we want to determine the social and health needs of the Tobago population. We have established an NCD registry, a non-communicable disease registry. What that will do, that will provide a repository for health-related data. That's in the budget. We want to be able to monitor what is happening in terms of diseases on this island. We've established a research ethics committee. Such committee will ensure that all ongoing research is monitored and all ongoing research meets ethical acceptability. We've engaged with other universities as we conduct research into cancer. And let me just say that this is a concern for us because just looking at the data, we recognize, whereas we weren't paying attention to colon cancer, colon is an area that we must address now. Whereas we were focusing on prostate, and then we thought we would look at the breast, we are now seeing some numbers increasing colon cancer among our population on this island. The other area that we want to leverage is that of family development. Most persons will know that we've rebranded the division and we're speaking to health, wellness, and family development. Family is important for us. The family is the bedrock of society. And this administration is, and in recognition of the need to support our families, we are paying attention to many areas. So our gender affairs units, our community social work, they will all provide a suite of services in a more coordinated way. Let me just speak as well to some of the coordination that we've enjoyed together with our partners in community development, enterprise development, and labor in that regard. Madam Presiding Officer, over the past decade, the profile of our population here, as I said earlier, had undergone some transition. And we really wanted to look at what is happening there. We looked at the work of Caldwell et al. In a 2006 paper, and we recognized that there's an increase in the over 60 age group. This change in age structure we think is important for us to pay attention to, and therefore we initiated measures to deal with issues of the elderly, the adolescent, and the children. With respect to the elderly or the aging, we've established an aging unit, and such unit will provide support for persons in their homes or in their communities. Let me just speak as well of the work done by Jennifer Rouse in 2010, which spoke to the dynamics and consequences of population aging in Trinidad and Tobago, a call for responsible planning and sustainable development. That is an important piece of work, and since we are talking about reading, we encourage those on the other side to read that piece of work. What we're seeing, though, is more than 12% of our population is over 60. We note as well the leading causes of morbidity in this group are chronic non-communicable diseases. We've looked at studies as well that point to those persons having arthritis, eye problems, hypertension, diabetes, and all of those face our elderly. Loneliness is another area. And we know that we must address that, and therefore our geriatric, and we say golden apple, the response program to that, we want to ensure that those persons are properly supported. We want to provide medical and social support in their homes. With respect to the other group in the family, Madam Presiding Officer, gender-based violence is an area that we are addressing, and so our programs for men, women, boys, and girls will be strengthened. We want to eliminate gender-based violence in our society. We want this to stop. We want this no longer in our communities. We will continue sensitizing all in our communities, including those on the other side, such that we will eliminate gender-based violence. With respect to the differently abled, another group in our families, at the 5th edition of the Down Syndrome Family Network Down Syndrome Conference, we gave the commitment that we provide new accommodation and improved services to that group of persons, and we've done that, and that is an achievement as well. We want to seek to include these persons in everything that we plan, persons with disability, persons who are hearing impaired, persons who are blind, such that we can plan services that are responsive to their needs. And for those who are not aware, our TechVox Center supports children who are differently abled. Madam Presiding Officer, we must protect our elderly and children. Our elderly have contributed to the development of our society. And for those persons who are in homes, we've established facility review committees. One committee is going to be looking at the older person's homes, the other for children. We want to ensure that these homes operate according to the established standards. With respect to our adolescents, we want to strengthen the programs for adolescent mothers, or PAM program, or school health program. That's an area that is going to be better resourced. With respect to those children in schools, we know that the schools continue to challenge us in terms of the support provided, and therefore we are collaborating with the Child Protection Unit of the TTPS, the Trinidad and Tobago Police Service, such that we could bring about greater awareness in terms of child abuse and the like. We are collaborating with the Children's Authority for the establishment of an assessment center. This assessment center we expect to be commissioned by September 2017, and that we will have child support centers established thereafter. Just looking at the improvements with respect to health-related services. I mentioned earlier that we are focusing on wellness. Let me just summarize and share some of the improvements so that persons wouldn't continue to be sick. They will pursue wellness. Primary care services, we are combating NCDs. We are waging an all-out war against them. We want to ensure that our population becomes healthy. And so we want to pay attention to those. But let me just share some statistics for the researchers on the other side. Trinidad and Tobago is ranked highest of all the Caribbean countries in terms of diabetes. And please look at the data. The prevalence of diabetes in Trinidad and Tobago is 11 to 13%. It is the third highest cause of mortality, accounting for 13.6 deaths, 13.6%. And so we have to pay attention to that. It is using up quite a lot of our resources. We want to pay some attention to that. Madam Presiding Officer, cardiovascular diseases is the highest ranking cause of deaths in Trinidad and Tobago, accounting for 25% of all deaths annually. High prevalence rates for diabetes and hypertension account for 20%, and they are contributing factors along with overweight, obesity, and the like. Heart disease, cancer, diabetes, and CVAs account for 62% of all deaths. So grave is the problem, Madam Presiding Officer, that as far back as 2006, a national symposium was held, and we recall the activities of the Port of Spain Declaration in that regard. Much has been done. Now our patients benefit from the CDAP program, so there's free medication. But we must, in our division and in our island, address early detection and integrate our responses so that we become much more comprehensive as we respond to this situation. More importantly, Madam Presiding Officer, we know the management of diabetes depends largely on the behaviors of our population. And so persons with diabetes must change their lifestyles and adjust to a complex diabetes self-management regimen. But notwithstanding these challenges, Madam Presiding Officer, our teams in primary care have been making inroads with our health promotion and disease prevention agenda. We will continue to empower our patients or clients to be very effective in terms of self-care. At the individual and community level, our health education efforts will continue. We will encourage persons to continue to exercise greater responsibility for their health as we reorganize our responses. We are empowering our communities and involve them in the management of the health system. We are encouraging them to participate in shifting the model from sickness to wellness. We are building alliances. Madam Presiding Officer, we continue to collaborate with all partners in that regard. We are creating supportive environments for them. Let me just point to one of the efforts we are making in schools. We intend to launch shortly our Healthy Eating in Schools project, which will take into account 1 high school and 3 primary schools in Tobago. Soon we will approach other divisions of the THA and the private sector to create healthy workspaces. Our communities will be encouraged to use our parks and playgrounds for play. Just to note, our Executive Council has approved the establishment of a Health and Wellness Center as part of our Health and Wellness Trust. And this center is expected to promote health and wellness. We focus on diabetes management, stroke management, and the like. So far, we have established a site. The team is developing a plan, the things that many people point to that we don't do. And we expect to have the Stroke and Diabetes Center implemented by the first quarter of fiscal 2017-2018. In the matter of sustainable public-private partnerships, the Executive Council also approved the development of a palliative care center, and we'll engage in a PPP as well for cancer care on this island. I did say cancer was a priority. Our immunization targets, and most people know they're over 90%, but we want to maintain those targets. With respect to the plan of action, the primary care team will be focusing on risk factor reduction, management of our NCDs, monitoring of our services, governance and policy, and advocacy. Just quickly in terms of risk factor reduction, Madam Presiding Officer. Our efforts will include promoting physical activity and promoting healthy foods. So we'll support access to healthy foods in collaboration with the agriculture and other sectors. Let's just look as well in terms of the other priority that we will want to treat with. We will want to support the marketing, the reduction of high fats and sugar and high salt in our foods. We will pursue access to health education for children along the life course. The next priority area that we will focus on in terms of primary care, let me just say that the comprehensiveness with which we respond is important. We'll improve and strengthen existing programs like the HEAL-C, the sexual health for adolescent HIV contact tracing. We'll continue our collaboration with Family Planning Association with respect to sexual and reproductive health. Our community health initiative will continue, our men's health initiative will continue, and our community young women's program will also continue. We'll examine the extent to which we are adhering to CHRC guidelines for treatment and support for diabetes and hypertension. We'll strengthen our screening programs in the community. We will strengthen early detection and treatment for many of the priority diseases. Madam Presiding Officer, we wish to reduce the admissions to hospital for heart attacks and strokes by 30%. When I looked at the data, in 2016 alone, we had 168 persons presenting with strokes, and that is a cause for concern. Madam Presiding Officer, we also propose to decrease diabetes amputations by 20%. The numbers are quite high. For 2017, we already had 46 amputations. That is a cause for concern, and we intend to address those areas. With respect to the third area, the primary care team would be looking at, and of course, we mentioned that we already have our NCD registry approved. We will promote and strengthen our capacity for surveillance of NCDs. An area that's not looked at a lot, mental health. Our mental health outreach program and our mental health and wellness clinic will continue to facilitate referrals to the nearest health centers. But there are expansions, and that was pointed to earlier. The extended hours in 3 health centers will recommence: Canaan, Scarborough, and Roxborough. Roxborough, the service will continue up to 8 p.m., it extends to 8 p.m., but new services will be added: a pain management clinic, screening for diabetes, eye disease. All of these will happen in the extended hours program. We already recruited additional staff to support those extended hours, that being a challenge why the service was curtailed. In terms of infrastructure, the Moriah and the Roxborough Urgent Care Centers, those form part of our budget, and we look forward to the early commencement of the Moriah, firstly, Moriah Health Center, followed by the commencement of the Roxborough Urgent Care Center. With respect to secondary care, further to the realignment of the subspecialties, we are benefiting from some improvement, with respect to our patients' encounters. In terms of inpatient service, Madam Presiding Officer, we note a decrease in wait time in our ER, and that we know will continue to improve as we seek to move those persons who now wait in our ER as they go to Canaan, Roxborough, and Scarborough for non-emergency care. Internal medicine. We could boast of a successful partnership between medicine and nursing for our warfarin clinics. We are going to strengthen our nurse-led palliative care service. Our cath lab is expected to be reviewed. Our oncology service will be expanded. In terms of surgery, our vascular clinic, our renal patients who now are compromised, requiring AV fistulas or grafts, they can now look forward to a more comprehensive and predictable service through the engagement of a vascular surgeon. With respect to our orthopedic service, we now have joint replacement that will be available to us early 2018, and that is not now available. Pediatrics, screening for sickle cell disease. This is a service that is not available in any other hospital that I know, and that Tobago is doing this already. We expect to continue a satellite clinic at Canaan twice monthly. Ophthalmology, the service is second to none. The equipment is all at international standard, and we expect to continue maintaining that standard. With respect to our blood transfusion service, we encourage persons to become voluntary blood donors so as to boost our supply. With respect to obstetric care, we are integrating the care of our pregnant mothers between secondary and primary care. We expect to have this fully implemented by the beginning of 2018. And let me just say of a project that we can speak to now, the maternity ward at Scarborough General and Buku Health Center commenced a pilot project where we introduce perinatal information system. We expect to be able to compare our data about pregnancy and childbirth with respect to that. And this is the first in terms of, in the history of the RHAs, that this has been done. Madam Presiding Officer, still on some improvements. When we looked and took a snapshot of May and June of this year, we noted an adjustment in terms of the code of practice. We noted a reduction in the number of C-sections from 33.8% to 13.3%. Madam Presiding Officer, we will soon implement ultrasound in one health center within the next fiscal period. With respect to outpatient service, notwithstanding some inefficiencies that exist in terms of the the availability of your records whenever you present for care, we expect to address those. But we note still that we've had over 40,000 persons visiting the outpatient clinic last year.
Member, you have about 4 minutes left.
With respect to leadership and governance, the matter of leadership must be addressed as we continue to speak to our agenda. And so we understand that the role and function must be addressed. We will work towards building relationships as we make sense of what we do. The matter of governance is a key area that we must strengthen because we must hold persons to account. We must account for stewardship. Madam Presiding Officer, in terms of management, the void in health administration and service coordination is to be filled through the approval of the Executive Council and the early recruitment of those persons to fill those positions. We expect that improvement in healthcare administration and the monitoring and evaluation of services will be strengthened. Madam Presiding Officer, we are mapping our road to accreditation, and so all areas are presently reviewing and documenting their standard operating procedures and protocols as we seek to have a hospital accredited within 1 year. With respect to the transfer of patients, we intend to continue monitoring these transfers so we reduce the unnecessary expenditure to private institutions. We continue to build our capacity, Madam Presiding Officer, in terms of training our professionals such that they will be better equipped. With respect to our public health division, we intend to review and re-establish the role of the CMOH, the County Medical Officer of Health, according to the policy guidelines. We will continue our sensitization in terms of understanding our environment and taking care of environment and preventing vector-borne diseases. Our public health services, we will continue to build the capacity of that staff to respond to the needs of our population. But more importantly, though, Madam Presiding Officer, we'll establish a laboratory service for food and water quality testing in Tobago, which is not now available. Madam Presiding Officer, we'll establish a crematorium because we want to provide our population with other options which they may require when they have somebody who has passed on. Finally, Madam Presiding Officer, on average, the Tobago health sector has performed reasonably well, but there's much more to be done to deliver on its mandate. We will accelerate our plans in terms of service excellence and service quality. We will improve corporate effectiveness. The number of beds per thousand is above the Caribbean average. Our hospital is pursuing accreditation by 2018. Our expenditure has increased over the years, but we'll explore value for money. We'll turn the system in a way that has not been experienced before, such that wellness is the focus and not sickness. Madam Presiding Officer, for those who are already ill, we'll provide high quality care to them at hospital. We invite those on the other side. Those who have been accustomed to hiding in our hospitals, we invite you to come again. Madam Presiding Officer, For families, we'll assist in improving their quality of life through supporting their physical, functional, social, psychological, and emotional domains. Our families will experience these changes as their lives will be improved. Our community-based services will be more proactive and more collaborative as they engage other sectors, thereby intervening to address the circumstances that may arise. Madam Presiding Officer, members of this House, our teams in both primary and secondary care are committed to making each patient encounter a high-quality one. This investment in the health of the population must yield returns in a healthier Tobago people. Our population in Tobago demands and will experience no less. I thank you.
Members, I'm awaiting a request for someone to continue with the debate at this time. Okay. Is this a sign that we are ready to wrap up this debate? I will give a few more minutes for you all to make a request as to someone to speak next. Okay. I have given an additional 2 minutes for persons to make up their minds about speaking and contributing as part of this debate. Since no one has made a request, you leave me no choice but to request the mover of the motion to move forward.
Thank you, Madam Presiding Officer. I joined this debate quite prematurely to wrap up. And, you know, Madam Presiding Officer, when I penned my closing remarks, I did so, you know, quite probably prophetically. And it is amazing how true to form things have played out in this honorable house today. Huh? Don't worry, I'm coming there. So I want to say, as my colleague reminded me, special good afternoon to the chiefs, to you, Madam Presiding Officer, Chief Sec, and the rest of the team and the members of the House on the opposite side. But, Madam Presiding Officer, once again, and in customary Watsonian fashion, this honorable House would have witnessed the abdication of the responsibility of members opposite in fulfilling their roles and function. And again, a failure to contribute productively to this island socioeconomic development and support the 2018 fiscal package and the estimates of revenue and expenditure. Madam Presiding Officer, you know, John 3:16 is so applicable and relevant. If you so love, you'd be willing to give. And if there is a love for this island, if there's a love for the people of Tobago, persons are required to show magnanimity, to show a level of professionalism, and let us all work together in the interests of the people of Tobago. We can disagree on the politics, but one thing we must never disagree on is our love for and our need to work together in a bipartisan manner to discuss issues as we advance Tobago's development. And because my closing remarks, I wrote them this morning, just like Councillor Faith Israel, I too indicated that this is a bittersweet day in Tobago's history. Because, Madam Presiding Officer, never before in this House have we seen an attempt to mislead this House by peddling misinformation as fact. And this is the reason it's so bitter. Because in a sort of careless and carefree manner, information was put to this House that was, in fact, incorrect and misleading. And I will clarify that in a little bit, Madam Presiding Officer. But while amidst this bitterness, I can derive some sweetness and some positive outlook because of the fact that members on this side, we came prepared, we did our homework, we sat and we deliberated to undertake Tobago's people's business. And for that, I want to contribute all the members on this side who had a chance to you know, at least participate in debate, and I know other members around the table are sitting ready and waiting. And the thing is, Madam Presiding Officer, if the minority team, leader and his team, if they were unaware as to the convention, what would apply at today's sitting, if they did not want to appraise themselves of what happened in the past, they could have looked at YouTube, look at the previous budget debates, or they might have been able to seek our counsel or seek persons in Tobago who would have been members of this honorable house so that they would not bring a premature end to today's sitting. But as I said in my budget statement, that the people of Tobago are wise, they are prudent, and in due course, they'll make the right decision. And I'm putting it on record again, as I did in my maiden statement in this house, that there might be a need come next election, when there is more likely to be a 12-0, for the president to implement two independent members, because persons would have voted just for an opposition, but what we are seeing here is really not an opposition, and it's a dereliction of duty. Madam Presiding Officer, the first issue I want to deal with today is a statement and some information that the minority leader placed on the House querying my GDP, the GDP estimates in the budget. And he quoted a figure, and he stated that that figure came from a CSO document. I investigated prior to us publishing the budget document. I had my office call CSO. No such CSO document exists. It does not exist. And when he quoted the figure, I said, but this figure sounds familiar. And I made a call. I said, check this document and send it to me. And Madam Presiding Officer, it was a publication by an economist on the Tobago economy. It was not, in fact, official CSO statistics. It was never published by the CSO. And I want to urge the member opposite, please temper your statement. Now you're trying to score political points and you want to, show you're in campaign mode. But please, I beg you, let us compare data. The data that we cited would have been work done by the Tobago survey undertaken by the Division of Finance and the Economy. So if you're quoting official data, data must match with data. And if you're showing me that from the publisher of the document, I indeed commend you, sir, because in 2013 you also assisted me as well. And it's one of my friends, it's an intellectual I respect, and we normally have discourse. But please, don't put the work over as official CSO statistics in an attempt to discredit the work, the hard work of the Division of Finance and the Economy and the hard-working technocrats in the Tobago House of Assembly. That is wrong. That is indeed wrong. The second thing I want to treat with, Madam Presiding Officer, is a statement that says, away with the ACH. The ACH system was implemented to improve payment processes to workers, employees of the Assembly, and our suppliers. So when you're saying away with it, what you are saying away with is an improvement to the payments for workers, so that they can get not their payments on time, so that they can get their payments ahead of time. Because a lot of the employees in the Tobago House of Assembly will tell you now that their funds are hitting their bank accounts sometimes on the 27th and so on, days before the official pay. And that is something I think we as an assembly should be proud of in terms of improving the payments to our internal stakeholders as well as our external stakeholders. So please, Mr. Minority Leader, please temper your statements. The second misinformation that was peddled in this house would have been the level of consultation among stakeholders and the the budget survey was again came in for some criticisms, but just to inform you, and I think probably you don't know, and probably persons around you are totally unaware of it. The sample size for the budget survey was 643 persons, and they will tell you that that is more than an adequate sample size in terms of surveys. The budget consultations that we undertook, it was with the Chamber, agri-processors, the agri-society, youth organizations, and tourism sectors. It is on Hansard, it's on record that it was said that the persons in the sectors were unhappy with the budget. I looked at the responses from the agri sector. They were happy about it. The Chamber as well, they indicated the only concerns that they had would have been for a little bit more information on the fast ferry. The Chief Secretary provided that information, and myself, we clarified that in the budget as well. And so please again, Madam Presiding Officer, another misleading bit of statement, another misleading statement from the minority side. And you know, on a positive note, you heard one or two nuggets from the minority leader. But when you check back, it would have been statements either in the budget crafted another way, or statements that he picked up from the Chief Secretary that he certainly adopted and embraced as himself. So those one or two nuggets, you know, again, I commend you. I could be magnanimous as well. I commend you for them. Now, you made a point that there should be an introduction of the Tobago Export Agency to deal with trade in Tobago. That was outlined in my budget to deal with trade and export under the Sector Development Unit in the Division of Finance. Again, commendable, but we mentioned it in the budget. You just took it and you crafted it another way. But, Madam Presiding Officer, I think, and just to clarify the point on the survey, the demographics, you know, we surveyed across all Tobago and from varied walks of life. So I'm not sure who you're talking to, might be your supporters, but I'm not sure who you're talking to. But in terms of data, survey information, we pride ourselves on the integrity of data. Councillor Dr. Carrington also echoed those sentiments, and I make it a pet peeve to fact check everything that we put in the budget statement. This is not guesswork, and we're not doing this to score political points because we are serious about the people's business. Madam Presiding Officer, let me say this is my 5th budget presentation, but you know, you get so accustomed to a certain way of doing things. And Madam Presiding Officer, when you compare the past with the present, sometimes you get to appreciate the need to have some things just as the way they were in, you know. Mr. Was it Andre Tanker who said, bring back the old time days? So it's a warning to members opposite. I think we will have the old time days come back again, and then we will have some fresh debate. Because while we did not have a dissenting voice, the level of intellectual debate and discourse as we mapped out and identified the plans of the people of Tobago, it was rich. And I want to thank the members on this side. I know you're prepared. I know some of you are eager and ready to debate. As I bring this session to a close, I want to again thank all the persons who have participated in the budget survey, the consultations. I want to thank the hardworking staff of the Division of Finance and Economy and the divisions of planning. We have spent many long hours, many days, many nights, many weekends, and as well the administrators and the rest of the team. What I can boldly say is, just as we had in the previous term, we have another dream team willing and ready to take Tobago to the next level as we unleash the creative and productive capacity of our people for 2017 and onward. And just to clarify one final point in terms of, and I think I said I could be magnanimous, but, you know, and again, when you hear some things positive on the other side, it would have been statements that we made that they coined. In terms of the budgeting and planning models, I indicated that we are going to undertake a review of the CDPs in the budget, and we will, and just to outline in detail, we will undertake a review of how far that we have moved along the development trajectory, assess the constraints, and so on. So if, in fact, it might have been missed in the perusals and the members on the other side just perusing the document and not going through the document in some detail, I would understand that challenge in terms of some of the points that we were hearing. And while the minority leader would have afforded us an opportunity of some of his nocturnal activities and nocturnal dreams, the only nightmare I might have been able to deduce from this budget, this excellent budget statement would have been how do I craft, how am I going to craft a response to punch some holes in this budget statement. So I could understand the nightmares that they but again, thank you, Chief Secretary. Thanks to all the team on a well-crafted budget statement. And Madam Presiding Officer, let me say that thank you again, and I beg to move, Madam Presiding Officer. And Madam Presiding Officer, I kindly ask that we revert to the committee stage, as we shall consider the documents before us that we tabled earlier in the sitting on Thursday.
The sitting of the House will now be suspended to revert to the Finance Committee for further deliberations before the motion is moved.
Madam Presiding Officer, the House will now resolve itself in committee stage, Standing Order 65-1, requires that the Chamber declares that the Finance Committee can conduct its deliberations with right.
We now request for the Chamber to be cleared so that the Finance Committee can continue its deliberations.
There are hidden stories about Tobago's history tucked away in the memories of men and women who served in the Assembly. They hold the key to unlocking some of the knowledge surrounding Tobago's legislative history. The Assembly Legislature Secretariat is an apolitical division that oversees the plenary sitting on the fourth Thursday of each month, where the public can view debates on Tobago's affairs. But Tobago's legislative authority did not begin with the current Tobago House of Assembly. The first formation of the legislative representation was in 1768 at the island's former capital, Georgetown, now Studley Park, with a 13-member elected House of Assembly, a lower house and the appointed Legislative Council, and the upper house. 1 year later, Scarborough became the island's new capital, and consequentially the seat of Tobago's politics was relocated. These were during colonial times, when the operations of the Assembly favored the European settlers. The abolition in slavery in 1834 was the catalyst for empowerment throughout the world. Tobago was not exempt from this movement towards self-rule. In 1877, representative government was abolished, with the Crown Colony introduced to handle the administration of the island. In 1889, Tobago was joined with Trinidad by the British government. The Tobago House of Assembly was created by Act 37 of 1980 for making better provisions for the administration of Tobago and for matters therein. It comprises 7 divisions, each representing a developmental concern. THA has legislative arm and the executive arm, in addition to 10 divisions, 9 with particular remits, plus the Office of the Chief Secretary, which oversees the others. There is so much to learn, and to help you do this, the Secretariat now has an archive project for all Assemblymen from 1980 to present. Today we start with a few officials who served in between 1980 and 1988. In 1980, the Assembly was led by a chairman. At this time, it was Arthur Napoleon Raymond Robinson, now deceased.
That 1977 motion by A.N.R. Robinson, which led to the creation of the current Tobago House of Assembly by Act 37 of 1980, because I understood the need and the desire for Tobagonians for self-determination, I appreciated the effort, and I somewhat associated with that greater autonomy for the people of Tobago. So I understood the struggle, I understood the reason, and therefore, while the PNM contested that election in 1980 and lost, we won 4 seats and the then DAC won 8. I understood the need for greater autonomy for Tobago.
At that time, there were 2 political parties represented in the Assembly. Mr. Calenda was on the minority side, held by the People's National Movement, but control of the House was with Mr. Robinson and the Democratic Action Congress.
We are the architect of self-government for Tobago, and the Parliament would have decided that Tobago should have its internal self-government in 1977. However, when the legislation was passed in Parliament, and that legislation, as you know, is Act number 37 of 1980, to give effect to the decision of Parliament, it stopped woefully short of giving us international government.
And that has always been our mantra. From 1984 to all our years, internal self-government was foremost in our mind. And that's even why A.N.R. Robinson went to Parliament and debated on internal self-government for all those years. And that is why instead of giving us internal self-government, they gave us this partial management of Tobago, which is more of an administrative kind of a situation.
As a lot of people do not know, we worked for about 5 to 8 months without a salary. The central government in Trinidad didn't care to give Tobago House of Assembly, and so they were not working for harmonious relationship between the Tobago House of Assembly and the central government.
From the year 1980 to present, administrative changes have been made to ensure that the Tobago House of Assembly expands to make responsibility for more of the day-to-day matters on the island.
Well, of course, most of it are administrative changes. First, there was no executive council when it started, because the executive council is usually the government responsible to the legislature.
At that first THA elections, our inauguration took place what is now the High Court. It was then Tobago's Hall of Justice, was on the only court out at Bacalet. So our inauguration took place there, and our plenary sittings took place there. Most of our committee meetings took place at the Fairfield complex. So that's how we operated, and we operated in committee stages. Like, you know, there was a health committee, a roads committee, and all those various committees. All members of the Assembly then, though, operated as members of the Finance and General Purposes Committee.
There was no executive. The executive was the plenary and the Finance and General Purposes Committee. So anybody else who functioned would have functioned in a committee, and these committees, by way of their deliberation and the reports that they bring, these reports are brought to the Assembly in plenary, and it is the discussion and debate on that and the approval of that you can now implement. Very frustrating, because, as you know, we were no longer a county council. Then we started the restoration of this building that we now occupy. We began since in 84, and so on. And we went to England, sent people to England to do the research as to how the building was when it housed the first Tobago House of Assembly in the 1760s, 1763, 1769. And then we were able to restore the building to how close to what it used to be, because some of the things we couldn't get. And in 1985, we completed that record timing, 4 years. And Her Majesty Queen Elizabeth, if you notice the plaque next door, would have come and unveiled that plaque to mark the opening of this particular chamber, and then we were able to meet here. It was not easy, because this building at that time was occupied by the library.
The Assembly building has since been through further restoration in 2010, but the building was not the only feature undergoing changes. A lot of effort was made to change the laws that govern the Tobago House of Assembly. This meant getting Parliament to change the Constitution.
I think the most significant one was Robinson motion in 1977. In the Assembly between 80 to 84, there was that motion by Dr. Jeff Davidson. Subsequent to that, after 1995, between 91 and 95, there was an attempt by the Manning administration, while Chairman Denoon was chairman of the Assembly, to grant Tobago greater autonomy. Unfortunately, while efforts were made and legislation were drafted, there was a call for early elections, so that effort fell by the wayside. And then there were again another effort, again led by Robinson, now part of the NAR, that created Act 40 of 1996, which took it a step further. But during that period, during the first period of the Assembly, we operated, to me, as a hybrid of the Tobago County Council, because there was not the positions of chief secretary or secretaries.
We had to set up systems. We did this first by creating what is called an administrative body. And this is the forerunner of the Executive Council. The administrative body was responsible to the legislature at that time. But in 1996, the change had changed, the old act went out and the new act came in, creating an executive council run in which the chief secretary was the chairman. But prior to that, the chairman was responsible both for the legislature and what passed for an executive council.
The chairman of the Tobago House of Assembly was responsible for the executive and the legislature. Since 1996, the positions of Chief Secretary and Presiding Officer were created. The Chief Secretary leads the Executive Council that manages Tobago's administrative matters, and the Presiding Officer oversees the legislature. But the chairman was not the only position that changed in 1996.
My office as a leader and responsible for setting up the new structure for the new assembly that was put into being by Act number 27, 1980 was in the Sandy Hall building. So the clerk of the assembly was there, and the clerk then was what we now call the chief administrator. And the secretary office was next to me. The secretary is now what we call the clerk of the assembly. That was the secretary. And in fact, it was Mr. Roach. So all of us were in this small building in County Hall. I am the politician responsible for putting the administration in accordance with the new law. And they were actually one the secretary of the assembly as plenary, and the other one as the chief administrator, head of the public service. Because of that kind of situation, we have to find accommodation, and we have to make it quickly.
The background of politicians may vary. Miriam Caesar Moore started as a nurse. Her desire to help people took an unexpected turn into politics.
People's home was on fire. And as a nurse, everything just kicked in. I ran up to the hospital, I called the fire department, ran up to the hospital. And there we were able to bring out some people, save people from that blaze. I was asked to come on the TV to speak about this matter. They were interviewing me, and I guess Ian Robinson, I don't know if he saw it or what, but I know because of that incident and the fact that I came and helped and was assisting, probably people saw that as someone who can do something, can be of service for Tobago.
Life as an assemblyman had its own challenges.
For us to get anything done for Tobago in our portfolio, we had to actually be like not bullies, but we have to say, if we fought for this, it is ours and we are going to make it happen. So when they withhold, sometimes for months we didn't get pay. As I said, we work for $2,500 a month, and it took you a while to get it because, again, of the logistics and the bureaucracy. And it is heartening that we did not give up. We kept at it, we stayed with it, and now Tobago is reaping the benefit of the Tobago House of Assembly.
During that term, interestingly, there was a motion moved by Jeff Davidson. I think it started in late 1982, which even at that time, although we were operating under Act 37 of 1980, still called for greater autonomy for the people of Tobago. That motion went as far as to say that if the government of Trinidad and Tobago did not accede to the desire of the representative of the people of Tobago, then Tobago should seek to move to full independence with its own territorial waters. And that is to tell you the depth and to the extent of the struggle and the desire of those people at that time. So today, as we continue this debate after 37 years, I think it's the same call. You're witnessing the same call and that burning desire, because Tobagonians still feel that they are not given the opportunity to govern themselves.
So we felt that we were onto something big, and that Tobago was really, we felt a part of Tobago, and that is why I tell people, I tell my children, that you really don't understand this history of Tobago until you can birth it, you have it in your soul. At that time, we, the assemblymen, had it in our soul, in our souls. We felt that even though we have to give our lives, we have to give our time and our energies for this new baby, we were prepared to do that. So the Tobago House of Assembly became a part of us, and in extension, Tobago became a part of us. So people may look at that as being insular, Some people may say, oh, well, if Tobago, that small place, you know, why all this emphasis on Tobago? This is what other people were saying, the Trinidadians were saying, that they couldn't understand why we want to be different. History made us different.
Thank you, Madam Presiding Officer. I'm pleased to report that the committee has met and approved all the items, including within the schedule for the Tobago House of Assembly. The Tobago House of Assembly's draft estimates for recurrent expenditure for fiscal 2017-2018. Similarly, approval was given for all items under the development program, as well as the Unemployment Relief Program, URP, and the Community-Based Environmental Protection and Enhancement Program. Madam Presiding Officer, I wish to thank you very much and all members for attending the committee sitting. I thank you.
Members, the motion has been carried for the House. The House approved the draft estimates of the revenue and expenditure respecting all functions of the Tobago House of Assembly for the financial year October 1st, 2017 to September 30th, 2018, copies of which were laid on the table at an earlier stage of the proceedings. I thank you all for participating in the 2018 budget.
Thank you, Madam Presiding Officer. I beg to move that this House now stand adjourned to a date to be fixed.
Members, this House now stands at the question is that this House stand adjourned for a date to be fixed. All in favor?
Aye.
Any against? This House stands adjourned for a date to be fixed.